Brandy's a former Merck pharmaceutical sales rep. Brandy founded the Council for Vaccine Safety in response to the industry's unprecedented push to eliminate medical choice with regards to vaccine. She recently launched the Learn the Risk campaign using billboards and other media to raise public awareness of vaccine risk. She's the mother of a healthy, vaccine-free 4-year-old. Her website is www.learntherisk.org, and she is also a chick on a mission getting the word out there.
What I want to start off with, because most people only listen to the first minute of what you say, vaccines do more harm than good. That's the most important thing you can take away from tonight. And I'm going to explain to you how I came to that conclusion. So, stepping back, I used to work for Merck. I sold a drug that some of you may remember. I sold Vioxx. It was a painkiller. It was on the market for 5 years. It caused anywhere from 100,000 to 500,000 deaths, it's estimated. 7 billion in fines, largest drug recall in the world. It's not if I have blood on my hands, it's that I do. In the lawsuits that came out, it showed that Merck actually knew that the drug was killing people before it was even FDA approved. So, what did I learn from that? I learned that just because something's on the market doesn't mean it's safe. The regulatory system in the US is bought. It's basically filled with people from the industry. And I learned not to trust pharma. I also learned how deeply entrenched they are in our healthcare system, in the medical schools, in medical research, in the doctor's offices. Pharma spends way more money on marketing their products than they do research and development. So, after that, I went to Europe for 8 years. I learned how things are done very differently over there. I was living in Holland, and it's one of the healthiest, tallest countries in the world. And they're very into homeopathy, very into natural health. They didn't even know what allergies were when I went to the best expat doctor in Amsterdam. So I learned a lot over there. I had a natural birth, home birth, with my son, and then I came back with him to the States when he was 6 months old. And the doctor said, "What do you mean he doesn't have vaccines?" And I said, "Well, the midwife, said, wait, he's healthy. Why do we need to talk about vaccines?" So, he was like, 20 vaccines at least to catch him up. And I said, I don't think so. Let's look at the inserts. He didn't like that. Walked out. I did my research. My son is now 5 tomorrow, and he's vaccine-free, and I have a lot to say on this issue. How I got involved was with SB 277. Last February, I heard about it, and I cried for 3 weeks because I knew that my life as I knew it was over. You don't work in pharma and then speak out against them and have an easy life. And that has come to play, unfortunately, but it's not stopping me. And I think it's really, really important that people need to understand that what doctors are being told, what pharma is telling us, what the media is telling us, which is 40% of advertising dollars are linked to pharma, we're being lied to, and we need to take back our health, and we need to do our own research. Thank you very much.
Thank you, Brandy.